Hi everyone, this is journal entry number 4 for MN669. Today I'm going to discuss a new experience that I had with one of the previous clients or patients that my preceptor had an appointment with. I'd never seen, read the diagnosis before, you see it in your books, but I've never actually seen a patient with this diagnosis and such a young age with this diagnosis. This patient was an adolescent 14-year-old girl that was diagnosed with OCD, which is obsessive compulsive disorder, and also anxiety. She had intrusive fears of germs. So she was constantly washing her hands, cleaning spaces that she was in. She had anxiety just of, germs and things not being clean, and contamination. So constantly washing her hands, constantly, disinfecting spaces that she uses, and just trying to make sure that she's, germ-free, I guess would be the best way to explain it. Over the past year, it seemed like her symptoms were worsening. And so she was coming in for her follow-up just to see, what she could do to better maintain or better control her current diagnosis and also symptoms. The provider did refer her over for therapy, which I think was good. I do believe that it was cognitive behavioral therapy that she'll probably start off with once a week to help her with one of the treatment plans. And then also her medication management, just making sure that she's, taking her medication as prescribed, and if she's noticing that her symptoms are getting worse, ensuring that, she's letting the provider know, like, hey, this really is not working for me. I believe that as of right now, she was taking fluoxetine, 10 milligrams daily. So we're, just checking to see, make sure that that's effective. But she did say that her symptoms had been worsening like over the past year, and especially like within the last couple months. So, but I will say that, it was interesting to see and to experience. So I hope you enjoyed my journal entry for this week, for week 4, and I will see you again next week. Bye.